Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers. Today, kids may be missing out socially and learning-wise because they spend so much time on their mobile phones and other devices, but what if they were more intentional about their screen time? Stephanie Desmon talks to psychologist Dr. Shreya Hessler about a course she created at Loyola University Maryland, which encourages students to choose a more offline path, and to Emma Hester, one of her students who did just that. Let's listen.
Shreya Hessler and Emma Hester, thanks so much for joining me.
Thanks for having us.
Dr. Shreya Hessler, you recently taught a digital detox class at Loyola University, and I'm dying to know what that is.
I'm really excited to talk about it. So the digital detox piece is a little bit of a misnomer. It was kind of like a clickbait for students to enroll in the class, which it filled up pretty quickly. But it was actually a class in experiential learning and learning about the psychological impact of using technology in our day-to-day, everyday lives. And so it was more of a class, less of abstinence, but more of intentional use and contemplation of how using technology of all kinds serve us or don't serve us from a psychological perspective.
So what does the landscape look like?
So the landscape really looks like what I was seeing on a day-to-day basis in clinical practice. And I see individuals actually across the lifespan, all the way from elementary school up into later years of life. And what I started to notice with Generation Z in particular was that individuals were in session were telling me they were having conversations with significant others, their parents, etc., and they were digital in format and not conversational and human, requiring eye contact. And what I was finding is they were super anxious. They were reading into those communication methodologies and really feeling a lot of angst. And so I was thinking about how could we develop an opportunity for students in this generation, individuals in this generation, entering in their third decade of life, to understand what it looks like to have these, what we used to think human soft skills were, but are actually necessities for us to be able to interact with each other, on a day-to-day basis. And so I was trying to respond to what I was seeing as a clinician in private practice day to day, and really trying to see this generation that I thought was being missed in the conversations between professionals and researchers on digital harm reduction.
So you went analog. What do you mean by that?
Okay, so Emma could probably talk about this. I did send an email prior to the first week of class to give them a warning. But when I say analog, I meant on the first day of class, I give each student a journal and a pen. And I said, this is going to be how you learn and note take this semester, unless you have an accommodation that you need, because we would always meet those accommodations, right? And I told them I wanted to hear no notifications, nothing with an on and off switch, and that when they entered the classroom, that was going to be the space that there was nothing with an on and off switch during the time that we taught class. And so it even meant that I didn't use PowerPoint. I lectured the entire time. We did a lot of activities, etc. And that's what I mean by analog. For twice a week, 75 minutes, nothing with an on and off switch.
Emma, how did that make you feel?
Coming into the class, I definitely was not expecting to have zero use of technology. I feel like a lot of professors will say, don't use your phones, no digital usage in this class, but people will do it anyway, and it's just kind of like a slap on the wrist. So coming into this and hearing that things were going to be completely analog and we weren't going to be able to have any sort of phones, it was a bit anxiety-inducing. You think that you need your phone next to you at all times, and that if you don't have it, you'll be missing something super important. That fear of missing out piece was really big and present as soon as she said that we were going to have no phones in this class. So it was definitely an anxiety-inducing moment.
What did you learn in the class?
We learned so many different ideas about digitally detoxing, there were a lot. Every week, we kind of covered a different topic. One of the things we talked about was the difference of like fear of missing out versus joy of missing out. So being able to be okay with not doing things, that was something that I had never thought about. You always think about, what are my friends doing? Like, what am I missing out on? And checking social media, seeing if you can find what you're missing out on. But I was starting to be okay with sitting back and not looking at social media all the time if I couldn't make it to a social gathering. And that was a big game changer for me. Also, just being a college kid and having fun. That's something that I learned in this class, actually, which kind of sounds funny, but we went outside and played flag football one day during our class, and it was the most fun day of college I've had. I'm a senior, and it went by in an instant. I thought that we were out there for 5 minutes, and we'd been out there for the majority of the class period. So I really learned to be a kid again, and that it's okay to be a little uncomfortable if your phone isn't around you all the time. And I'm okay with that now.
So it's been a month or two since the class ended. Well, how have your habits changed, maybe permanently?
Yeah. So our class was at 9:25 Tuesdays and Thursdays. And I've noticed that now, since we started this new semester, I don't have detox in my schedule, but I put my phone in my book bag before I'm even in the classroom. And I was like, wait, I didn't need to do that, I guess. But it was just a automatic habit. I also definitely limit my social media use now. I used to be a big doom scroller, is what we call it, like before bed. And I've completely cut that out. I used to watch TV to fall asleep, and I don't do that anymore. But the biggest change I would say is that after class, I would always reach for my phone right away, and I would look, see what I missed out on. But I'm so much more willing now to not grab it right away and to talk to people in my class and walk outside and maybe grab a coffee with them before even thinking to check it. So it really has given me more freedom in that sense as well.
Shreya, I have to ask how this makes you feel.
Oh my gosh. I think my face hurts from smiling so much. And it's really lovely. I've gotten some correspondence from other students over the last week or so about what they're taking with them. And that same Tuesday, Thursday, like 9:30, I think one student is actually taking a class this semester in the same classroom that I taught in. And it is actually a class where they're required to use a lot of technology. And the student is just like, it feels so bizarre to be in that space and have the opposite, type of experience. But it was really, that was my mission, right? To do a couple of things. Stephanie, to see them, right? You can't really step back from something that you really haven't had a lot of scaffolding and experience from. I mean, this generation gets a lot of talk at, put your phone down, you should get off, you should do this. What they didn't get was an experience together as students to be able to have it scaffolded for them. And then to think about doing that twice a week for 16 weeks, I think really made an impact. And so I've been getting a lot of just emails and feedback from the students about how it's resonated and they're maintaining or building off of what they learned in the class in their own ways, right? From an individual level. And that was really the goal. So I'm thrilled. I'm super thrilled.
You're a psychologist, and I'm curious, we're all spending a lot of time on the screen. I was going to say, what is it doing to the Gen Z brain? But what is it doing to all of our brains?
So I think neurologically, it makes us feel this sense of urgency, automaticity, and it changes the way we feel like we need to process information. And so I think one of the things that I worry about across the board, not just with Gen Z, is, we don't know what to do with boredom. We don't know how to be creative again. We don't know how to have conversation, I mentioned before again. And that impacts our brain. That impacts how we see the world, how we interact with others, how we make assumptions, how we get information, how we digest information. And so when our brains are overstimulated, it's not designed to be overstimulated at the level that it is constantly. There's no place else to put it. And so the absence of that just seems that much more jarring.
Shreya, do you want other people to follow your model here?
Yeah, I think I'm still figuring it out, Stephanie. I mean, the class definitely was rooted in science. It's a 400 level class. And, Emma mentioned that we played flag football outside, but there was a purpose behind it. There were, lectures about what play is. And, some of the students in class had mentioned that they couldn't even remember the last time they did it without a digital interface involved, right? And so I really feel like I would love to teach this class again and build on it because the students were responding so well and they didn't even know they needed it. And that's what they said at the end of the semester. They just didn't know what they were missing because they just didn't have the opportunity to experience some of those exercises that we talked about and understand the science behind it without being shamed. So that was what my vision was for me to be able to see them and hear them and know what their lived experience is like, and then ask them together to lean in as opposed to on an individual basis. I'd love to teach this class again. I hope I will. And I'd love to see it replicated across universities.
So you talk a lot about science. Was that a key to making this a successful class?
Yeah, because I think students are really bright and they want to know the rationale paired with the experience. Why did I feel what I felt when I felt it? Whether that was discomfort, boredom, fun, frustration, I really felt like they needed to have the understanding of why their brains may or may not have been doing what they're doing and lean into that critical thinking and curiosity. Emma will tell you that I use that word ad nauseum, to really force students to ask the question of the why behind and understand what behavior change does to our brains and our well-being overall, our emotional regulation, et cetera. And so when you're a psychology major and in your mostly senior years, especially since some of them were seeking higher education in psychology after graduation, I wanted to make sure they understood that the rationale and the science behind why the push to change our relationships with technology need to happen.
I mean, I personally feel like technology rules my life, and I am not a Gen Zer. I try to put the phone away while I'm working, but then when I sign into my office system, it tells me I need to get a code that's going to be sent to my phone. So it almost feels like it's working against me. What kind of advice do you have for folks of a certain age, like myself and yourself?
I think that's a hard question, right? That's a question that I think is individual. And I think that's what the students we're seeing too. No two students had the same plan, right, about how they were going to take the information from the term. But the whole premise of how I advise my patients, my students, friends, et cetera, is really about intention and saying things out loud to be like, I'm going to do this because. So for example, if you're needing to get an authentication code or whatever, say, I need to get this authentication code, and then I'm going to go back to doing what I'm doing. If I'm struck with boredom, really asking out loud, even if no one else is in the room, to say, what am I going to do with this device, right? What am I doing right now? And being able to walk away from it is hard, but it's a practice response, right? And so a lot of times, just like all behavior change, we expect that it's going to be automatic, but we have to practice it. And oftentimes it's really helpful to share the experience of a digital change, right, in terms of their behavior with somebody else. And that's what this class was, right? So lots of students talked about what their intentions were, and then they followed up with the class the following week, right? So there's a little bit of accountability that happens there. And so those are some strategies I think that have worked clinically with my patients, but also I saw demonstrated in the class.
Yeah. And Emma, how is this going to change how you interact with people? And I imagine you might be telling your friends this is probably a good idea to try a little bit.
Yeah, it's given me a new sense of freedom when I didn't really know that I was trapped in the first place. I didn't know that this was something that I could benefit from. And my friends are definitely have been hearing me talk about this throughout the last semester. They do board game nights with me. We had an intentional plan for a 24 to 48 hour detox entirely from technology as best we could. It's all about intention, and all my friends did it with me. So I really think that this is something that we'll talk about for a long time, and I have a lot of memories from that board game night. So even if just that came from it, I would be okay with it.
Schools are banning cell phones these days at a higher clip. What should we make of that, and what will that accomplish?
So I actually think it accomplishes a lot. The bell-to-bell initiatives, the initial research is saying that it has an impact on attention and focus and learning in the classroom. The challenge is that outside the bell-to-bell, the technology then returns, right? And so a big fan of, just like this class, of teaching kids as young as 5, 6, 7 about the intention piece I'm going to do X, Y, and Z with this device, and verbalizing and vocalizing, and then also having parents model and scaffold what to do with the device. And then in the classroom, it's not just the absence, but it's the discussion of why. And that's what I think is missing, right? Is if you don't have the understanding of the why, then it always feels punitive and it feels like a back and forth, right? That teachers, administrators, parents have. And I think that's something that we have to unpack a little bit. So I'm a big fan of minimizing as much as possible so that the social skills developments happen organically like previous generations did, et cetera. But at the same time, like you said, tech is everywhere, right? And so abstinence from bell to bell is a good start. But I think there's something missing about scaffolding at every developmental age behind the why and the how-to when you come across technology.
Shreya Hessler, Emma Hester, thank you both so much for joining me.
Thanks for having us.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.